Autism spectrum disorder. Autism spectrum disorder is a neurodevelopmental condition characterized by qualitative impairment in social interaction and communication, as well as repetitive stereotype behavior, interests, and activities. These features are present early in development and cause impairment of social and academic functioning. Diagnosis is based on careful assessment of behavior, cognitive development, and language skills. Treatment, which should be initiated early, involves educational and behavioral management, medical therapy, and family counseling. Epidemiology: more common in males than females, 4:1. Age: symptoms typically manifest before 2 to 3 years of age. Etiology: the etiology of autism spectrum disorder is complex and multifactorial. The following factors have been identified: genetics, strong underlying predisposition, notably higher prevalence in monozygotic twins and siblings. Many genes have been found to be associated with autism spectrum disorders. Environmental factors, for example toxin exposure, prenatal infections, may increase the risk of ASD. However, no specific causes have been identified. Clinical features, core features, persistent impairment in communication and social interaction, for example, inability to form relationships, abnormal language development, reduced empathy, difficulties in adjusting behavior to social situations, and poor eye contact. Restricted stereotyped patterns of behavior, interests, and activities, for example hand flapping, excessive touching or smelling, lining up toys, adverse response to sounds, and echolalia. Echolalia is the repetition or echoing of words or sounds that you hear someone else say. It is an important step for language development in children. Echolalia can also be a sign of autism or developmental disability in children or neurological problem in adults. It is a non-voluntary behavior that causes someone to repeat what other people say. Repetitive movements, for example, stereotyped hand movements. Additional features: intellectual impairment, language impairment, sensory abnormalities. Sensation can be hyper-responsive or enhanced. Mild autism spectrum disorder, formerly referred to as high-functioning autism. No intellectual impairment. Affected individuals are able to speak in full sentences, read and write, and handle basic life skills, for example, personal care, housekeeping, cooking, shopping. Symptoms may not become fully apparent until school age, when social impairments and stereotypes begin to exceed limited capabilities. Impaired social communication and interaction, for example, limited interest in social interaction, absent giant attention. Giant attention is the ability to share focus on an object or event with another person, playing a vital role in social interaction, communication, and learning. Insistence on sameness, for example, eating specific foods in a particular order. Fixated interest in unusual objects, for example, ceiling fans. Unusual responses to sensory stimuli, for example, preferences for touching certain textures and strong aversions to others. Affected individuals may develop strategies that mask deficits later in life. Associated conditions: numerous genetic, neurological, and behavioral disorders occur in association with ASD, the occurrence and severity of which vary widely. Epilepsy, other neurodevelopmental and psychiatric disorders, for example ADHD, pica, anxiety disorder, genetic disorders, for example tuberous sclerosis. Tuberous sclerosis is a genetic disorder that causes non-cancerous benign tumors to grow in various organs, particularly the brain, skin, kidneys, heart and lungs. Autism spectrum disorder can occur due to brain lesions. Fragile X syndrome. Fragile X syndrome is a genetic condition that causes intellectual disability, behavioral issues, delayed speech and language skills. Rett syndrome. Rett syndrome is a genetic condition, primarily in girls, which causes developmental regression, communication difficulties, physical or motor impairment associated with a higher head circumference to brain volume ratio. Diagnosis: comprehensive evaluation of social interaction and communication skills, language and comprehension skills, behavior, cognitive development, associated conditions, hearing and vision testing to rule out comorbidities or other causes of developmental delays and behavioral disorders, genetic testing, Fragile X syndrome, tuberous sclerosis, if any of these conditions is suspected. Treatment: early behavioral and educational management should be started already in preschool, greatly improves outcomes, competence training, social skills, communication skills, establishing clear and consistent structures, family support and counseling, for example, parental education on interaction with the child and acceptance of his or her behavior, medical treatment, SSRIs, repetitive stereotyped behavior, anxiety, antipsychotic drugs, aggression, self-injury, methylphenidate, ADHD, risperidone and aripiprazole are the only FDA-approved drugs for controlling irritability in patients with autism spectrum disorder. There is no medical treatment for autism spectrum disorder. Medical treatment is for associated conditions. Prognosis: indicators of poor prognosis, severe core symptoms, cognitive impairment, low IQ, poor or absent language skills. Language development is a major determinant of prognosis. Late initiation of treatment, impaired social interaction often persists into adulthood. The majority of patients are dependent, even as adults, on their family and familiar surroundings. Individuals with good language and cognitive ability usually learn to cope with their particularities. Exceptional skills in specific areas often lead to success in academic and professional endeavors. Approximately 50% of individuals with language impairment do not develop the ability to speak. Adolescents' insensitive behavior towards peers often results in social exclusion. Thank you.